it's CJ. Welcome to week 30 of your pregnancy. Today we're going to talk about what's happening with your tiny human, some of the more common symptoms that you might be having, steps you can take to alleviate some of those symptoms. And if you stick around, I will tell you my thoughts about home Dopplers, what I like about them and what I really don't. So at 30 weeks, your baby is now roughly the same size as either a head of cabbage or a loaf of bread. It depends on which app you're looking at. Yep, he or she is now measuring right around 16 inches or 40.5 centimeters from the top of their head to the bottom of their feet and weighs somewhere between 2.7 and 3.7 pounds. That's roughly 1,300 to 1,700 grams. Your baby is now gaining right around a half a pound a week. The lungs are continuing to mature in preparation for life outside of your uterus. Those tiny hairs that have been covering your little one, called lanugo, are starting to disappear. And here's some really good news. If you were to deliver this week and have access to excellent neonatal care, your baby now has about a 95 to 98% chance to survive. So at 30 weeks, here are some of the more common symptoms that you might be noticing. Number one, your fundal height. The top of your uterus is now measuring between 28 and 32 centimeters from the top of your pubic bone. Number two, fetal movement. You should be feeling your baby moving every single day. Number three, fatigue. You are really tired. After all, making a human is hard work. I recommend trying to get as much rest as you possibly can. And if that's not working, please talk to your provider. Fatigue can also be related to either anemia or depression. Number four, mood swings, probably because you're tired. But if your mood swings are getting in the way of you enjoying your life, again, please talk to your OB provider. You might have either depression or anxiety. Number five, shortness of breath. It is very normal for you to get winded when you walk up a flight of stairs. However, it is not okay for you to have shortness of breath accompanied by chest pain. And number six, mild swelling in your hands and your feet. I recommend elevating your feet whenever you possibly can. Add fresh lemon to your water. If you know you're going to be on your feet all day, try wearing compression stockings. That being said, if you have a sudden onset of severe swelling, if you have swelling in your face, those are potential symptoms of preeclampsia and you need to notify your OB provider right away. All right, so let's talk about fetal Dopplers. The three things that I really like about them. First of all, it's fun to listen to your baby's heartbeat. Second, they are perfectly safe for both you as well as your baby. And third, if your partner is unable to attend your prenatal visit, this gives them an opportunity to listen to their baby's heart beating. So here are the three things that I really don't like about fetal Dopplers. Number one, most mamas can't hear anything before 15 weeks, and that can cause unnecessary anxiety. Number two, the Doppler is just looking for a heartbeat. It can't tell the difference between you and your baby's. If you're looking for your baby's heartbeat and can't find it and your anxiety level is high, so is your heart rate. You may be listening to your heartbeat and not your baby's, which can give you false reassurance and also delay the care that you might need. Number three, and this is the most important part, fetal Dopplers don't tell you anything about fetal well-being. They will tell you that your baby has a heartbeat, but they cannot let you know whether or not your baby's in distress. If you feel like your baby's fetal movement is decreased, it is really, really important that you go straight to the hospital and be put on a monitor. That is the only way to determine if your placenta is functioning properly. I do hope that this information has been helpful and that if you have any questions, you'll leave those for me in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button, or even better, feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.